Hey, I'm Dr. Garyana Demers. I'm an orthopedic sports medicine surgeon, and I have successfully integrated orthobiologics into my busy practice so that I can provide a continuum of care and treat patients who are in the gap. The gap is this gray area in orthopedics where standard conservative treatments have not been effective, but surgery may not be warranted. And we usually tell our patients, come back when it's worse. What? These are your patients coming to you for help. Orthobiologics is that solution that can fill the gap and help you treat your patients who are in your office looking to you for help. Orthobiologics can also be an excellent treatment for frustrating problems without good surgical outcomes. This podcast will help you create the orthobiologics business that will make you love your job again. We will focus on the value of orthobiologics, patient selection, how to talk to your patients about money, office setup, and other logistics. If this is something you've always wanted but don't know where to start, join me in the Business of Orthobiologics podcast. How are you doing?
I am doing good. How about yourself?
I'm pretty good. It's, I think this time of year is always hard. It's the mad dash to the end, and everyone's trying to get everything sorted out before the new year. So, I have not learned a good lesson. I've heard amazing things where, I have a friend whose company wraps everything up for the year by December 1st. And so then they just coast in December.
Wow.
Which, why shouldn't I do that? That seems like a brilliant plan,
Is the company a healthcare company too, or no?
No. But I don't know. I own my own business. I can run my business any way I desire. So I've been toying with that idea. Maybe a way to stop this craziness that exists. Every stinking December is like this, right?
Time of the year, yeah.
Yeah, it's not sustainable, I don't think. And it just kind of leaves me like exhausted, like going into the new year, like, holy cow, instead of starting the new year refreshed and ready and doing all the things, I don't know. I'm totally open for suggestions. I have no idea. It's not working currently.
What I have done in the past is I would always take off between Christmas Day and New Year's Day. And at a certain point, I was stretching it out to 10 days, and I was wanting to stretch it out to 2 weeks.
Yeah.
Yeah, where you're just gone. And then because in my practice, I do have physical therapy, they keep working, even when I'm not there. Yeah. Sure. And so there's, yeah.
I mean, I do truly, like, we usually have at least 1 week off, either over Christmas or over New Year's. I'm actually going to be gone. I'm going to see my family for Christmas, but my husband is on call. So he's going to be home, which is summer. So he's going to be by himself for, 5-6 days, and then I'll come back and then we'll go to Cabo. We always do Cabo every year. I want to do 2 weeks in Cabo, but that does not exist in his world right now. So I keep bugging him to do more in his cash practice and less in his employed practice, but it's coming along. He's like it's all about mindset, right?
It's a mindset. It's
so interesting. So that was part of what I wanted to talk about today, was like that mindset of what's holding you back and where you're stuck. So if you're interested, I do think that it's so much. This is what I was thinking about today with my husband. It's so much mindset. We're getting in our own way, and they're like, "Well, I can't do that because of blah 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 or whatever, And then you just have to say, "Is that true?" And in reality, usually it's not. It's just a reason that we've put out there to keep doing what we're doing, right?
Absolutely. And then, so I've been in practice for over 20 years. I left residency in 1996, so that's like 27 years ago. And You just get used to doing things a certain way, and then you do it that way year after year after year. And then you form a habit, you know, and then to kind of pick yourself, up from there and go to this completely different, way of doing things, and then there's some anxiety involved with that to say, what if, and what if, all right. And on the other side, you're being cheated out of your, you know, I mean, and,
Really.
but that's sure, you have these humongous insurance companies who have, take all this money, they stiff you as the provider, they stiff the patients too.
Right.
And so, no, that's just not right. And
Yeah.
that's not the way I want to continue things. But then you have to build, this other practice. But now I know I can do it. I know I can do it. So it's just a matter of getting started, you know.
Yeah.
Yeah.
How did you come around to that shift in mindset?
It's just that one, you really, really have to value yourself, and you have to value your services and what you do. Because once you come to that realization to say, you know what, if you value what I provide to you, then you'll be able to take care of, of these services,
Mm-hmm.
So now my clientele is going to shift. I know that already
Okay.
because I'm hearing the resistance from some people. No, I'll only do it if insurance pays for it. So I know my relationship with folks like that is probably short term,
Yeah. Yeah.
absolutely. Yeah.
It's interesting, talking about value. I have a virtual assistant and he's in Kenya, and I was talking to him this morning. And
Wow.
he was saying, I was telling him, like, we were talking, like, I think some social media posts on this program. And I was saying, do you want to help your patients and, provide better care? And he's like, well, it is better. This is a better way. And I was like, I love you. I was like, I'm so glad you're drinking the Kool-Aid.
Oh,
He's
wow.
not a physician. He went through this course. He did all of the coursework,
I
um,
see.
and to be familiarized with the product. And he
Okay.
just like, this makes so much sense. He's fully bought into the fact that orthobiologics is better
Mm-hmm.
for the patient and better for the doctor. And we have to
Mm-hmm.
figure out a better way. And like I think we were talking about last week, when you have that confidence that your package
Yeah.
is going to get them the best results,
Yeah.
it's easy to sell.
Yep.
It's just like, this is the best way. How can I help you get the best results?
Mm.
Right? Like, well, we could do this other thing. It's pretty inferior, so I'm
Yeah.
not going to recommend it.
Yeah.
And they know it.
I know it's still going to be a step for me from
What
I
do you
was
think
thinking
is,
about,
yeah, what do you think is
yeah.
the hardest part?
I've thought for a couple of years the price for PRP is $1,000 or $1,200. So now to package it, to add other things to it, and then it's 3 times that, sometimes I still get, to say,
Yeah.
yeah.
Well, maybe I can share my experience and maybe
Okay.
it'll help you
Okay.
because this trajectory of price changing, it has been an interesting experience. So I started out at 1,000,
Okay. Okay.
not that long ago,
I see.
like not that long ago at all. Maybe last year, let's just say.
Okay.
Okay. Yeah, last year, 2022, I think my price was just about maybe 1,000 or 1,200
I
for a
see.
PRP injection. And then I met Matt and he said, no, double it. And I was like, I can't do that.
Mm,
I can't do it. I don't know why. I like
that scares the crap out of me. He's like, okay, just make it 1,500.
Okay.
Like, okay, that doesn't sound
Not
too scary.
too much.
Yeah,
Yeah.
that's not too far off, because maybe I started at 1,200 or something. And so I went to 1,500
Okay.
and 0 people balked. The people that are going to buy it are going to buy it not because of the price. They're going to buy it because it's valuable,
Mm.
right? And so it actually doesn't matter what price you put at it.
Wow. So you're saying nobody bought when you went
No, no,
from
no, no. Nobody even was
oh, they
worried.
bought. They didn't. Yeah, okay,
They
got
didn't
it.
balk. They were like, okay.
Wow.
I was like, I just changed my prices like a lot
Mm-hmm.
in my mind.
Mm-hmm.
And nobody said boo. Nobody said anything except for okay. And then so I was like, okay, well, and then so I went to 1,800 and nobody said anything. And then I went to 2,100. And that was probably 2,100 was probably 4 months ago, 5 months ago. And then, but I was then instituting these packages, and so the a la carte price was 2,100, but then the package price was like 3,500 or 4,500, something like that. And I was having a really tough time selling the packages because I was like, getting lost in the weeds. I was doing the nitty gritty, like, well, if then, and then they were like, well, if I don't want that, can I have this? Can I do subs this in and that? I'm like, all right, this is ridiculous. And I didn't have as much confidence in my package. And so it came across. And so I didn't sell packages. So then I was stuck selling just the a la carte 2,100. And
Mm-hmm.
then I was like sick of it. I was like, God, I'm sick of sucking at selling packages.
Mm-hmm.
So I just made that decision. I was like, all right, that's it. They're all packages. And my PRP across the board is 3,500.
Take it or
And that's
leave.
it's with a package. And
Okay.
if you want the package, you don't have to have the package, but I'm not even going to tell you what's in it because my PRP is 3,500 and it includes CBD, repair sleeve, 12 sessions of laser, the whole 30 book. Like that's just what it includes because I know by adding on all those parts. Hi, fellas. I know by adding on all those parts that they're actually going to do better. And so ultimately, I made that shift a couple months ago,
Okay.
and it's changed my revenue stream. It has not changed how many people say yes.
Mm.
And I also upped my BMC or my cellular therapy, and I also upped my spine prices
Mm.
significantly.
I see.
And so just today, I had a 2-level spine that came and my spine prices because number one, because I don't like them because they're longer for me because
Yep.
I'm not as facile. I don't have 10,000 injections under my belt. I only have 5 years of experience, right? And so they're harder for me. I have to focus more. It's just not second nature. Like, how you were like, oh, we just get comfortable
Yeah.
doing this, right? I'm not to that comfortable spot yet. And so I made the price point a little higher because it was harder for me. So my single level spine is 5,100, and that includes the package too. And then, and if it's another level, it's 2,000 for a second level.
Second level. What do you do? What do you target when you do your spine?
It's comprehensive spine. And so I know you've heard everybody talk about this comprehensive spine situation. I think it comes from the Regenix, but there's also other people that are using comprehensive spine. Ani Navani was just published maybe 2 years ago on comprehensive spine. And that is all of the things. So facets, ligaments, so ligamentum flavum, interspinous transverse process, as well as multifidus and epidural. So all of those together is the comprehensive spine
The
package.
package.
I know that Ashu Goyal, any spine is comprehensive, no matter the number of levels, and he charges, I think, $6,000, and it's 2 hours, and he blocks out 2 hours, and so he can get anything done that needs to be done in 2 hours, and it's $6,000 across the board. So there's lots of ways to kind of skin the cat, right? But I think my experience with raising prices is you can go incrementally, and then you're going to have small successes where you go, huh, No one said anything. The people who are going to say no are not going to say no because the pricing, it's very unlikely, right? If you are making a compelling discussion that it is the best choice for them, they're going to sort it out. Now, I've had a couple that they got early on. I quoted them, a package, and then they came back and they said no initially, and I'm like, oh well, it's just 2,100. They're like, oh well, I can do that. And but I think they just maybe needed more information or more hand holding. Rather than was it the price itself. I think that's an excuse because something else is not resonating with them. Does that make sense? That maybe an interim solution, and maybe just looking at the calendar and saying, okay, my pricing in 2024 is going to be 1,700 or 1,500 or 1,250. My husband, oh my gosh, so he does the O shot, right? And he started out at $1,100 or no, 1,200, because 1,200 is the price basement. So Charles Runnels, who trademarked the O shot, will not let you sell it for less than 1,200. So that might give you an idea that is the price basement for PRP. Across the board, that should be bargain basement price. Okay. So it's not $1,000. And also there was a study that was done that talked about the pricing, and it was done by Brian Cole, and he calculated what the appropriate price for PRP across the nation, all things and all the reimbursement and all the things. And I think it came out to something like, I want to say like 1,278, or maybe it was even higher than that. Maybe it was 1,478 or something like that. So if you're charging less than 1,200, you're below market value, for like bottom of the barrel. If you're charging, 1,500, you're probably on par with insurance-based care. Okay. So at least give yourself that and say there's studies that have been done for pricing that show that probably 1,500 for PRP is appropriate to start. So then if you just say, okay, in 2024, my price is 1,500, the cost of goods is going up for every single other business. You paid more for all of the things that you bought this last quarter than, a year ago. So prices go up. The price of, gas went up, the price of butter went up, price of eggs went up, price of PRP goes up. So, and you don't have to tell anybody, right? You don't have to make an announcement. Oh, we're raising our prices. Don't need to. That's just the price. Your gas station didn't call you and tell you that they're raising their prices. That's just the price, right? And so you don't need to justify what your pricing is. And then maybe every quarter, inch it up 200. And then by the next quarter, by next year, at the end of next year, you'll be at 1,900, and you'll have given yourself 100% raise.
Now that sounds
no extra work, right?
Yeah.
You need to do that. So 1,500, I think, is what you should probably at least start at for sure.
Okay.
Is that the same procedure that Matt was saying you should charge 3,500 for?
Well, with a package. So with a package, you will other things. Yeah.
By the way, the 3,500 I made up, right? I just made it up.
No, Matt said it last week. He was
Yeah.
It's probably right, but I honestly, I made that up, and I made up what's going into my package, and I was like, well, this is what I have in my, bag of tricks. So this is what I'm going to put in. And I stopped offering a la carte, and I offer PRP. And what PRP includes is all these things, take it or leave it. If you don't want it, you don't have to have it, but this is PRP, and the price of my PRP is 3,500, and I don't go any lower than that. And that has taken so much stress off of me so I don't have to sell any packages. This is just the price of doing business. But if you're going to go a la carte, like Diane, because in her brain, she thinks PRP is $1,000. And we just talked about the fact that's not true. So when we, like a mindset, you're like, is that true? No. We have scientific data that says that's not true. So what if you just said it's 1,500. What do you think would happen?
Probably nothing, but I think what I have to do is I have to stand in front of the mirror and just say it,
10
just
times at least.
over and over. Yeah.
Mhm. How much is PRP?
$1,500.
Yes.
Video yourself saying it.
Of course it is. How much is it? It's 1,500. And then stop talking.
And
No
that's-
justifications, right?
Mm,
Because then if you justify people that are like, well, why are you justifying? Is there a catch? Is there something weird? What's going on? Whereas if you just tell them the price, like how much is the price of bread? $6. Okay, great. And then in your mind, you're like, is this worth it? Is it not? And hopefully you've given them a compelling discussion on the fact that it is worth it because they want their life back. And they've told you, I'm here because I can't do this. I can't do this. I can't do this. I can't sleep. I can't do this. And you say, well, here's the price for getting your life back. When would you like to schedule?
okay. Yeah. Yeah.
And
Well, that's
another little thing that I've been using that's been resonating with my patients a lot is you deserve it.
Mm,
You deserve to get your life back. I know I can help you. You deserve it. Right? Because they do. Why are they like suffering? Nobody gets a gold star for suffering. They deserve to have their life back and they're worth it. And, I also have been sharing my parents just asked for Christmas for PRP.
oh, wow. Well, that tells you.
Right. I mean, I've treated them a number of times, different joints. And that's all they asked me. I said, what do you want for Christmas? They're like, well, actually, we'd like PRP for each of us and the airfare to get out there. I was like, okay, we can do that.
Wow.
But I've been sharing that with my patients that my family thinks it's valuable enough that that's what they want for Christmas. Right. So, and I usually give it to them for free. So, all right. Was that helpful, Diane?
Very, very much so. Thank you.
Yeah. It's just things you get stuck on and you can't figure a way out of a paper bag sometimes, You're just like, I don't know why I'm stuck in here. And then you turn around, you're like, oh, that's easy. Shoot.
Absolutely. Thanks.
Awesome. Yeah, absolutely. Okay. We were talking about what you guys are stuck on. What is the reason that it's not humming along, that you're not getting $25,000, $35,000, $45,000 in cash every month? Who wants to go next? Phyllis, you want to go?
Sure. Well, I'm not doing orthobiologics. I'm doing weight loss. And so you and I talked at the conference about, I need to stop kind of stuttering and I did. And I just, I just lay it out there. And so what we're doing, because we didn't do very well with our email 5130, we're going to be doing a text 5130 to see if we get better response. I think part of the problem was when it launched last time, kind of like somebody said last week, they didn't know where to go to find the responses. And so like a bunch of responses sat there for like a week. And so by the time we reached out, we don't know how much of it was that contributing to it. But even the people that came after that, like weren't responding to our calls. If we got somebody on the phone, they didn't want to come in. It's kind of like, so one of the things that we did was develop what's called kind of a wellness assessment, which is just kind of a brief history form that they could fill out, come in, kind of sample some of our technology and have a brief consult with me to talk about what their goals were, and what the health challenges were that were creating these goals. And we did get a few people sign up for that. I didn't get anybody to sign up for the program, even after doing that. And so
now remind me what the program does.
So
how it works.
So it's a lifestyle medicine course. It's a 10-week training talking about, all the things that affect people's, inability to lose weight. Like,
is
what
it
they're
in
eating, when
person or online?
It's all online. So it's all virtual. It incorporates homeopathic drops that really kind of take care of the appetite and the cravings. It's real food. And we kind of added 2 packages that include red light. So we have a red light bed. And we're seeing people who are doing the program, 20 to 35 pounds is typical. So women typically lose between 20 and 30, and the guys usually lose between 30 and 40. And that's really just taking the drops and eating the food and managing all the things that we teach them they need to manage, like, their stress and, their sleep and their mindfulness and all of that. It's getting people to sign up and buy. And so a lot of what we're doing now, we have a red light promo. And so people come in, they do the red light, and then we offer an opportunity for them to have kind of a free discovery call with me, especially if they say that one of their main concerns is weight. Even that is, we're struggling with getting people to show up for their call, because it's free. And it's like, oh, well, yeah, it's free.
Right.
So it's, yeah, I don't need to show up. And if they show up, then getting them to sign up. And so we thought we would try this texting campaign with the 5130, but the program we were going to promote is even more expensive than the more expensive red light program. So we have kind of a, a la carte, you could call it, without red light. So it includes a number of supplements, a detox supplement, a liver supplement if they're on the red light, and then the homeopathic drops. And then the platform, they have access to us every day to direct message us. We are reviewing what their progress is. And I do a weekly group call, just talking about, some of the lifestyle.
How come your program, your call is free?
The discovery call, because we offer free discovery call on our website.
Okay.
Now, typically that should be done by a staff. Okay. Typically, but I'm doing it now because I don't really have the staff trained to do that yet. And I feel like I'm more likely to get them adequately informed to really be interested in buying, to be honest. Okay. So
what are you selling? Are you selling so for me, you just told me I could lose 35 pounds in 10 weeks. That sounds amazing. And I don't have to eat any weird food. And all I got to do is go lay under the light and take some drops. Why do you think they're not saying yes?
I don't know. Maybe I'm not. Maybe I'm not convincing them. Yes.
Can I ask you something about your weight loss? I learned some stuff this weekend. So are you using Ozempic or any of those type of medications?
I'm not
okay.
yet.
All right. Okay. So this is what I heard this weekend at a pellet course. That is going away. Apparently, once the drug companies catch up with the dosages, they're not going to be able to compound a lot of that stuff. So it's very possible that's going away. So this is my opinion. I'm no expert, but I think you need to create a bleeding neck by letting them know that Ozempic's probably not going to be available. And so your way of weight management is absolutely necessary because they're not going to get to do the easy stuff anymore.
Right.
It's just a thought.
Yeah, no, I like that because, honestly, I had thought about adding that to the upgraded program as kind of if we don't get to where we want to the first 6 to 8 weeks, then I was going to use the tirzepatide to enhance it, the next go round. But I'm struggling selling a $26.99 program, which is the top tier right now. It's 12 sessions of red light, which is twice a week, and 6 weeks worth of the drops. And again, people do it the way they're supposed to, very predictable results. And so I don't know. Do you have any?
Yeah, I think that what I know about selling, and it's not selling, it's education and guidance, right? But what I know is they want the transformation. They don't care how they get there. So don't tell them about the how. Don't tell them about the red light and all these things. What it is helpful to do is address the objections, right? I don't want to eat any weird food. No, this is your whole foods. I don't want to do any like shots. Oh no shots, just drops. I don't want to do any tummy tests.
Strenuous exercise.
It's a strenuous exercise. Oh no, this is just lay there on a red light table, right?
Right.
So what you've done with those three things is you address their objections, but what you haven't really told me, and I'm not sure, is you're not painting that picture of
What are they missing out on?
not only what you're missing out on, like, right? So you have to be like scratching the wound a little bit and being like, do you look at the hill and think, oh my gosh, I can't ever climb up that hill? Do you ever, you just get at a block and you're winded? Are you sad that, you can't quite fit in your pants, even though you had to go up one size? Are you this, that, and the other, right? And then you say, what if I told you that we could solve this problem in 10 weeks without this, that, or the other? Right. And not selling the how, not selling the bridge, but selling what's on the other side. Like, imagine this, this time where you get to play with your kids, you don't get winded, you show up to your 30-year reunion and everyone's
you get off of some of those meds. That's the big
get off
one.
all of your medications that, you don't have to take the high blood pressure medication anymore. And that metformin, you don't have to take that anymore because you're now your ideal weight. And that promotion they passed you over for, you're going to get that promotion because they're going to think, wow, this person has stick-to-itness. Let's give her a shot. So I think it's, not selling the how, but the what. The what's on the other side. Like, what's that transformation? What does that look like? And what I've heard, and this really resonates, and I think it's been effective, is, and what emotion does it cause? So you have to tie that transformation then to the emotion that it causes. I'm going to be so relieved when I can finally fit in my high school jeans again. I'm going to, like any of those emotions, right? And it has to be tied to the person and their, issues. But I think that selling the transformation, you can use the how to address the objections, but then tie that to the emotion.
But it's really hard to get people to come in to have that conversation. So do you agree that it's okay to just schedule the call and just go through exactly what we talked about over the phone? Well, yeah, but because that's not the way the 5130 was kind of structured, at least the last time. We were told that, no, you have to get them in the office. No, you have to, get them in front of you, and you have to, no, they need to pay to come into the office. Like, that is really a struggle. It's virtually impossible.
So I structured my 5130 differently, and we used it in part. We also had ridiculous, overwhelming response, and so much so that we couldn't actually accommodate that.
That'd be a good problem to have.
Everybody's different, right? And so we couldn't actually accommodate. I couldn't get them into the clinic. And so what I did is I invited them to an informational seminar. And then they could, at the end of the seminar, they could schedule their candidacy evaluation for $97. That made it a little bit, right? Because that's like screening out looky-loos. Saving my time so I can address a bunch of people at once to say, this is the amazing opportunity. And then, we have to know if it's right for you. And then having them put down a little bit of skin in the game, come in and get an evaluation. And I tell them right up front, this evaluation is worth $397. I charge $400 an hour for an evaluation normally, but today only, at the end of the session, you can schedule your consultation, your candidacy evaluation for $97. Saves you that spot.
And that's kind of what we did with the wellness assessment. So I like that. The other thing, I think the webinar is actually a good idea, because one of the things that I had created already is what's called a masterclass. So it's a webinar where I talk about the program, how it works, why it works, and why, they should do it if they are struggling.
Yeah, maybe invite all of your 5130s to the webinar. And honestly, I would do it live. I would do a live webinar or in person. We did it in person so they could get to know our staff and get to know
Mhm.
me in person and know where our office was and kind of, get into it, because our office is really great. Like it's a
Mhm.
spot, right? You come in, there's
Yeah.
a waterfall, and you're like, oh,
Ours too. Yeah.
okay.
I think people are.
And so
Mhm.
we wanted them to come in person, but you could do an online webinar and then invite them if you want to know if you're a good candidate or whatever.
Mhm. Right.
Today only, like, schedule your call. But it works better in person because then they can just go to the front desk on the way out and be like, yes, I want
And
to see.
schedule. Right. Right. I
Yeah,
agree with that.
it does.
Okay. Well,
So
that's a
we
good
kind of
plan.
fiddled around with it because
Yeah.
so many of my patients were like, hey, I think you got hacked. We got this weird email. I was like, oh no, that was me. Would you like to come to our informational session?
Right. Right. Okay.
So
Well, that's
that's
helpful.
what we did.
Yeah. Great. Thank you.
Yes, absolutely. All right. Yes, Diane, you're muted. Here, I'm gonna unmute you. I don't know if I can.
Okay, I
Oh,
just
here
did.
you go.
You
Here
get
you
it.
go.
Okay. All right. Quick question is, the informational seminar, do you do that at your clinic? So you have them come to the clinic, and how many people are you, bringing in at a time?
Okay, well, so my clinic can accommodate probably 25.
Okay. Yeah.
I have a big presentation place.
Okay.
Yeah, with like a screen and everything and tables and chairs and stuff. So we can accommodate 25 at a time. So then that made more sense because, we had a very aggressive showing. And so then we could invite every single one of those patients to the seminar. And if they couldn't make that one, we did a second one. They're like, oh, we can't make it, but we'd love to. Like, oh, great news. Well, we're having one next month too. And so then we signed the ones who couldn't come for the next seminar. Make sense? Good.
Thank you. Yeah.
Deb, how you doing?
I'm good. My dogs were barking, so I had to
Oh,
unmute.
that's legal.
Doing great. Doing great.
How are things going?
Well, same thing. I've got like 11 appointments to convert this week. And I mean, I really don't have my packages all together.
You can borrow mine.
We have the prices in mind. I mean, I'm really not ready to convert, but I have to because it's now or never.
Yes. And are you ready? Yeah, you're totally ready. Do you believe that this is going to help patients?
Absolutely. I just don't
Done.
have the price down because I,
3,500.
okay. Because, I don't necessarily try to convert patients, but I have a guy who's been a patient for 10 years. He's in my target population.
Yeah.
And today we were going over I had him bring his disc today, and we just went over his cervical spine MRI, his shoulder, his elbow, and he was just full of places for me to inject PRP, just full of them.
You're like,
but he really, I didn't ask him. I just said, this is what we can do. We can do a cervical epidural for that problem here. We can inject your lateral epicondyle, but it would be better to put PRP in these torn tendons over here and blah, blah, blah. But, he wasn't really like, I think he was thinking, you just want to sell me stuff. And
Sure.
So he didn't say yes or no, but I think we're starting off with our insurance and doing those procedures first and kind of going through traditional.
Yeah.
But I don't know how to get him to jump on the bus. I guess I'll just start out with my toxic steroids and then kind of see where we go.
Well, so I've done it both ways. And, it does matter, like feeling the patient out and you're like, that's like that quick read the room, like rapid fire.
Yeah.
And then when their eyes light up, you're like, aha, I've got you. But again, you have to figure out why they're there. Like, and I had this argument with a patient, like she was naysaying everything. She's like, yeah, but I don't want to do that. And I'm like, if you are fine with all of the problems that you have and you are not having any pain, you are not having any dysfunction, you are 100% satisfied with your life, then you don't have to do anything. And we'll just, shake hands and out the door you go. And I'll be happy that you're 100% satisfied. But if you are not 100% satisfied with the state of your life, as you have told me before, I think I can help you, but we have to be equal partners in this. And so it's your choice. said, you're a grown adult. You can make the decision to do this or not. My opinion and my recommendations, and you can go get other recommendations from a bunch of other doctors, but for the problems that you have, the C-spine, the lateral condylitis, and the shoulder, after my exam of your MRI and of all of your physical exam, I think that the majority of your problems is coming from your C-spine. And while we could do an epidural, I think that you may be better served with platelet-rich plasma. Have you ever heard of platelet-rich plasma, right? Or you could even say, we could probably go for a standard epidural to see for your cervical spine. But here's the problem is for your elbow, steroids are not appropriate. And we really should do platelet-rich plasma to actually cause healing of those tendons. And if we're going to do platelet-rich plasma of the elbow, it would be really quite straightforward to do the platelet-rich plasma epidural at the same time. And, blah, 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 blah. And so you don't have to go all in and be like, PRP or nothing, but at the same time, you kind of lay crepe on the fact that, corticosteroids. And I say this every single time. I'm like, I could do corticosteroids. I could do a steroid injection, but, it does accelerate arthritis. It does cause weakening of the tendons. It causes osteoporosis and it elevates your blood sugar. So for all of those reasons, I really am hesitant unless it's an emergency to do, corticosteroid injections. They're like, oh, I didn't know it did all of that. Like, what else is there? I'm like, oh, I might have something for you that's much safer. And then, you go through it and you're like, unfortunately, your insurance company has decided that they don't want to cover that, but I do think this is the best option for you. And then shut your mouth or be like, how does that sound? Does that, are you ready to get your life back?
Let's talk packages. So
Yeah.
I don't
Let's talk
really
packages.
know what people are charging for certain services. Like for instance, and I think they talked about this earlier on the other Zoom this evening.
Yeah.
But okay, I get what you would charge for a basic joint, but for spine, to me, spine should be a lot more. And yeah, that said, that's my area I love. I want to do lots of that.
Yeah.
But do you charge per level? I heard someone was doing whatever they can do in 2 hours.
Yeah. So Ashu Goel, he does whatever they can get done, whatever the patient needs. He calls it the full comprehensive spine package, whether it's 1 level, 3 levels, facets only, SI, whatever. And it's $6,000, 2 hours is what he books. And it's this lovely spa experience. So he only books 2 or 3 in an afternoon, or I think 2, or whatever. And he loves it, and he loves what he does. I think it probably should be more.
2 hours?
Mm-hmm.
I
To
can't
do,
even imagine
5 levels or whatever.
Taking 2 hours.
Yeah, I think it's very leisurely and really lovely. And if you're making $6,000 in 2 hours, that's probably pretty fun, right? You're like, oh, okay, fun.
Okay.
But ultimately, that's not how I do my package. So for a joint, I charge $3,500, and I don't do a la carte. If I want to do a second joint, like I did 2 knees today, it's an extra $1,000. Now, Don Buford doesn't charge a smaller amount for the second joint. It would be $3,500 and $3,500. Boom. Okay.
So how many levels is too many? And the reason I ask this is because I haven't done orthobiologics in the spine. So I know that with some of the other treatments I've personally had, sometimes it hurts like hell afterwards. And I'm just kind of wondering how many levels on the spine would be too many to do at the same time.
So spine is different. Majority of people doing spine use a combination of spinal, platelet lysate and PRP.
Right.
PRP is sometimes a little irritating, but the flare reaction for spine patients is much less than the extremity flare reaction after PRP or cellular therapy, in my experience. They actually feel pretty good the next day. They feel a little sore, a little achy, like they got poked in the back a bunch of times. But that lysate it works pretty quick. And so it's a really nice anti-inflammatory effect, actually. Now intradiscal is a whole different ballgame, but I'm not currently doing intradiscal at this point because, it's a little bit more advanced and it's a little bit more risk, and I'm just not that risk tolerant for that specific thing right now. And plus, 80% you don't need. Yeah. So, I mean, it may be what some people need, but it's not what the majority needs, right? And so I do 5,100 for a single level, and I add $2,000 a level.
Okay.
You can use that if you'd like. I was charging way, 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 way less for my a la cartes. So I was charging $2,700 for a spine single level, and then $1,000 an extra level. But I was feeling grumpy about it because I was doing too much work for not enough money. and I was not selling packages. So what's in my spine package? Same crap that's in my extremity package. Laser. It's a body sleeve. It's an Incrediwear body sleeve. It's CBD. It is Whole30 diet. I think there's one more thing. So that is what I've settled on because I feel really good. I don't have to remember. There's not like pixie choosy. Oh, if you choose the silver level, you get this. If you choose the gold level, I'm like, no. I can't remember all of the things. So I'm going to just go package, PRP, spine PRP, cellular therapy. End of story. And my cellular therapy is $6,500 for a single joint and then $2,000 for an additional joint.
Okay. I like those prices.
You can use this.
Down.
Yeah.
Your price list.
I'll put it in the chat. It's fine.
Okay.
Yeah. But
I like that.
ultimately, maybe what I'll actually do is I'll write it down on Mighty Networks.
Okay. That's great. Yeah. Your patients won't ever see that. That's a good thing.
Right.
Yeah.
Well, hopefully they won't see it in my chat either. But.
Okay. All right. Semi-clinical questions. If you don't want to talk about it,
Sure.
then you let me know. But I've got like a 66-year-old healthy, lean pathologist who's been a patient for a while. Nothing worked. Nothing helped him. Nothing really. Just some degenerative disc disease. But what he ended up having that the spine surgeons might have settled on was kissing spine disease or Bastrop's disease. So the spine surgeon wanted to go in there and cut out some of his spinous processes. And I'm like, I don't know. That just doesn't sound like a good idea to me, cutting stuff out because you're going to be disrupting the ligaments. Why don't you let me inject the ligaments with some PRP and let's see if that calms everything down. No, he went for the surgeon. And of course, he's just as miserable as he was. It's been 6 months. And I was going to do his PRP for free, at the time. But
I'm telling you, doctors are hard patients.
Yeah.
Because they have been brainwashed. Like standard doctor teaching is that PRP is bullshit. And surgeons are even worse, right?
Yep.
So I have 2 surgeons, but I have the 2 spine surgeons that work in my town. One of the spine surgeons, I did his rotator cuff with PRP. And he's like singing my praises. He's like, oh my God, this is the best thing. But yet, when I tell his patients that they need PRP for the spine, he's like, that shit doesn't work. I'm like, dude, really? So the
ingenuous.
Well, I think it's implicit bias. He doesn't realize that he's biased because he's thinking that there is only so many pieces of the pie. And that if he says that PRP is going to work for his patient, then he's going to lose a piece of the pie. Turns out it's not the same pie. Okay. Right. So these are not the same pies. So, and I don't think he's on purpose, really. I think it's this implicit bias that he just hasn't seen it work, doesn't see it work because he's not looking for it, right? I have colleagues all the time when they're reading the literature, oh, PRP's bullshit. And I'm like, put their journals. I'm like, nah, did you see in your journal? He's like, what? Where was that? I didn't see that. I'm like, yeah, well, it saw you. You just either can't read or don't have eyeballs or something. But it's this confirmational bias that what you don't know, you continue to ignore, right? You're like, nah, that's crap. I'm going to focus on what I like, what I know, and I'm going to continue to ignore instead of being open-minded and curious. Like, it's interesting. There's these PRP articles in my arthroplasty journal. Weird, or my spine journal. That's strange. I wonder what could be done. So I think honestly, you could probably do PRP in the ligaments and along that interface and see what you can get done.
Yeah, I'll talk to him about it some more. I mean, he's just desperate. He's desperate. He asked me about a pump. I'm like, no, you're not on enough narcotics to consider a pump. He's like, what about spinal cord stimulator? I said, no, let's not do anything like that till we try something less invasive that might heal you.
Right. So low
Still-
risk. I mean,
Yeah.
PRP, even a PRP epidural with a PRP of the ligaments, PRP in the multifidus muscles, like what does multifidus look like?
I need to get his MRI. I haven't looked at his MRI in about 6 months. I wasn't looking at multifidus muscles back then. So
Right.
I need
No,
to
but,
look at that
and
again.
radiologists don't talk about it at all.
No, I know. I
And-
just started looking the last couple months.
Isn't it mind blowing? You're like, oh
Yeah.
my gosh, there's so much atrophy. And you could just put PPP in the muscles for all of the multifidus atrophy. I mean, it helps. So if you can address the ligaments, address the facet joints, address that the area between the spinous process, and then do some ligaments, and maybe even consider, I don't know if you are familiar with prolotherapy, but you can add a little bit of prolotherapy to your PRP for the ligamentous application and give you some more stability. Because
I do that even before the PRP,
do what?
We could even do that before the PRP.
Totally. And it's super cheap. Just mix up
Then
some
how would you price that? The Prolo.
for one of those naysayers, $1 million. No, just kidding. So a little trick, if you're going to use insurance, they won't pay for Prolo, but what they will pay for is cortisone injections. And you can use nanogram dose dexamethasone in your prolotherapy because they didn't ask how much.
No, they didn't. They did not.
Yeah, 1 unit is what you are using, and the unit's very, very small. So that nanogram dose dexamethasone is like physiologic cortisone, right? Like cortisol, like a stress dose, like someone scared you, and you're like, ah. So I think that's what I've been doing for those cases with these big naysayers, where you're like, it's a test dose, see if you can get any kind of relief, any kind of response. Bill it to their insurance. We're either ligament injection under ultrasound guidance, or you can do small joint injections like facet injections, or you could do even like trigger point injections with corticosteroid and get paid for it. If you wanted to go that route for the super duper naysayer.
Like that.
All right. We're a little bit over, but as anyone else having burning questions, issues, problems, anything they're wanting answered today? Colin, you good? He's on black. I don't know. Can't see it.
Oh, yeah.
He's like, ah! I'm not calling you out, bro. It's fine. All right. Well, I am here. We'll see you next week. Oh, you have something, Diane? Yes.
I just wanted to send Deb words of encouragement to say she's gonna nail those, convert those patients and then come
Lord, I
back to
hope so.
tell us about it. And
Yes.
say, whoa, I
Pressure.
spoke to this
Pressure.
patient. Yeah.
Well,
absolutely.
but just remember, you're going to do great, because remember, you are offering them an amazing treatment. Remember how excited you were about the CGM? Because it
Yes.
was like
Nice.
game changer, right? PRP, once you get into this, because it still sometimes feels like pixie dust. You're like, is this really magic? But ultimately, it is an amazing opportunity. Colin he's having computer issues. He does have some questions. So we'll get that taken care of. But yeah, you're going to do amazing. It's just really go in there knowing that you can help them. You have an amazing solution for them. And I think the thing, Colin, will be right there. I am doing VMAC. Yeah. So we'll get to that. What Matt Glogly had to say that was so important, that has really changed the way that I attack things. When things are really important to me, I take a little step back and I put myself in that winning mindset. Like, I am going to get this. This is going to happen. I am going to be able to help this patient. And then tie that emotion to it and say, just like when you're selling to your patients, right? Sell it to yourself. Say, I'm going to be so ecstatic for my patient when they sign up for this course. I'm going to be so excited to give them the treatment that they deserve. And then go in as like, I have an amazing opportunity for you. And this is what we're going to do. I have the secret sauce, right? And this is how I feel about, and why I'm so passionate about teaching this is because this is the secret sauce that saved doctors' lives, right? This is what reinvigorates doctors to love their jobs again. Like, isn't this so exciting, right? It's like, it's a new like thing. You're like, what do I do? I know it's scary, but also it's so exciting. It's mind blowing. So Deb, you're going to do amazing. All right, Colin, you have some questions. Am I doing BMAC? Yes. Phyllis, you're going to go? Okay, thanks. I really like that. What other questions do you have? I know you're having some computer issues. Hopefully you can just type. I don't know. Let me see. Yep. I'm so sorry, Colin. Oh, your video and your mic are not working, but you can hear me. So just type in the chat what you're wondering about, and I can maybe talk to you about that. Oh, good. I can't see you. You're all black, and your video and your mic. That's okay. What can I help you with the BMAC? Or maybe we can just chat offline. Here, what I'll do. Yeah. Everyone, I'm just going to put my cell in the chat, and then Colin, if you want to just give me a ring, that'll be good. Otherwise, I will see you guys. Please feel free to take my cell number. It's free to give me a ring or whatever you want to do. 5035. Okay. So that is my cell. Colin, if you give me a ring, we'll get this done. Okay. Otherwise, I will see you guys next week. Deb, you're going to kill it. Diane, how much is PRP?
It's 3,500.
Deb will answer it for you.
I'm sorry.
All right. Bye, guys. I'll talk to you later. Have a good night.
This has been the Business of Orthobiologics podcast. Thank you so much for joining us today. If you want to know more, please join us on the website prp-now.com and click on the free masterclass. Also, don't forget to subscribe to this podcast to get more guidance on integrating PRP in your busy practice. Bye for now.